Thank you. Before the Pilgrims landed at Plymouth, we were here. Before the pen of Thomas Jefferson etched the majestic words of the Declaration of Independence across the pages of history, we were here. More than 2 centuries, our forebears labored in this country without wages. They made cotton king. They built the homes of their slave masters while suffering gross injustices and shameful humiliation. And yet, out of the bottomless pit of vitality, they continued to thrive and develop. If the inexcusable cruelties of slavery could not stop us, the opposition we now face will surely fail. Good afternoon. I hope that didn't throw you off. You were, y'all, you know, you're all. Thank you for the introduction. As much as I always tell people, make it short, make it short. They always chronicle my life history, so, you know, I've been around a little bit. You probably didn't think that, though. I kept looking around, I said, man, this is mostly women and beautiful. Now, I need to go, you know, I came at the wrong time. But anyway, we don't always have control over that, do we? I want to thank Mr. Hickman for inviting me to be your speaker this afternoon. And I know that you've spent a lot of time talking about leadership. And so what I've decided to do, that I would share my thoughts about leadership in terms of a man whose leadership is exemplary. I open my speech with a quote from Dr. King. He was one of the nation's greatest leaders, a man of great courage, dedication, commitment, compassion, and determination to change this country from 2 nations, one white, one black, one viewed as superior, while the other one was viewed as inferior. Like so many others, Dr. King raised a fundamental question about humanity. It was the age-old biblical scripture that we should do unto others as we would have others to do unto us. But this nation began with the enslavement of African people. And 100 years after the Emancipation Proclamation, this country was still struggling with the rights and roles of a people who looked different from the majority and were being treated as second-class citizens. I've read a lot about slavery, the cruelty inflicted on black people, the insults and degradation to us as human beings. From the 1940s on to the 60s, we were faced with fire hoses and billy clubs and our children being spat upon just because they wanted to attend a better school. And even while traveling this nation, black people were unable to eat at public restaurants, and having to go out into the bushes to relieve oneself was such a hurtful and humiliating experience. During the modern-day civil rights movement, King would remind his marchers of our history as slaves and what we had to endure, and that we've come too far to turn around. But how long were we able to withstand the struggle for equality? How were we able to take the cruelty, the crushing insults and violence upon us? How did King, Reverend Fred Shuttlesworth, Jesse Jackson, John Lewis, and Andy Young march straight into the face of those police dogs, water hoses, and billy clubs? What manner of men were these? What were they made of? What was so important about ending discrimination and segregation that would cause these people to put their very lives on the line? You see, Dr. King was a man of many talents. He was preacher, civil rights leader, humanitarian, author, father, husband, and a black man who had hopes and dreams for himself, his family, this nation, and the world. Dr. King was a student at Morehouse College, where Dr. Benjamin Mays was the president. Dr. Mays nurtured King by encouraging him to have a dream. Dr. Mays once said, and I quote, "It must be borne in mind that the tragedy of life does not lie in not reaching your goal. The tragedy lies in having no goal to reach. It isn't a calamity to die with dreams unfulfilled, but it is a calamity not to dream. It is not a disaster to be unable to capture your ideal, but it is a disaster to have no ideal to capture. It is not a disgrace not to reach the stars, but it's a disgrace to have no stars to reach for. Not failure, but low aim is a sin." End of quote. Dr. King spoke to the evils of humanity, not just to whites, but blacks as well. But notwithstanding the parade of horribles of racism, King kept going forward because he believed that goodwill always triumphed over evil. I believe that King always felt that no matter how ugly white people acted, no matter how unjust they could be, no matter how evil they were to his people, he believed that good always overcomes evil and love will always conquer hate. He was truly an extraordinary man, not because of any title or position he held, nor because of the people he knew or where he lived, or even his phenomenal oratorical skills, but because he had an unrelenting conscience that would not allow him to look away from the wrongdoings of this society, no matter who was committing them. Notwithstanding the terrible acts of violence and hate and even threats of death, Dr. King continued to face nonviolently the evils of that time: racial bigotry. Dr. King confronted the morality of this nation for how it treated certain members of its society simply because of the color of their skin. What was it about King and others that gave them the courage, determination, the optimism, the moral authority, and faith that their nonviolent efforts would change race relations in this nation? Why is it that the work of King is just as relevant today as it was yesterday? Because he stood against injustice and evil in our society, no matter whom the perpetrators were. The question I raise to you, our learned medical students this afternoon, is why? Why do most of us witness immorality, injustice, unfairness, and evil and simply look the other way? Why is it that far too many of us are willing to see others mistreated, no matter what the circumstances might be, and simply look the other way? Every day we witness some form of injustice, cruelty, inequity, evil, and wrongdoing in this society, and we go on with our lives as business as usual. We say nothing, we do nothing. Oh, I'm a revolutionist now, in case you didn't know that, from the 60s. My thoughts about Dr. King and his life go way beyond the fact that he led countless marches for equality. He boldly faced the enemies of freedom and was ultimately murdered. He had an unrelenting conscience to change society for the better. He valued righteousness more than wealth, more than fame, more than popularity, and more than his own very life. Dr. King once said that the ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at times of challenge and controversy. Too many of us are willing to sacrifice our principles of integrity, our morals, our sense of justice and fair play for the comfort and the convenience. We sacrifice it so we can just be a part. It is my belief that King stood for more than ending segregation and discrimination. It was his conscience that caused him to get involved in the Poor People's March, the Sanitation Workers' March in Memphis, Tennessee, and to march against the Vietnam War. He was one of the first persons to step out and speak against it. Can you imagine what that took for him to be able to do that? He was already unpopular. If you go back and look at the newspaper, the Cincinnati Enquirer, if you read back in the 50s, 40s, 50s, 60s, he was a troublemaker. He was a communist. Because the status quo always wants to maintain the status quo. What are you doing at your respective schools? Are you just satisfied because you got one of those seats? Or are you doing something to say to the policy of the school, to the dean's office, we have to do more and we can do better? It takes courage. But Dr. King was a Baptist preacher trained in the Judeo-Christian principles. He truly believed in treating others as he would want to be treated. He didn't take on the cause of racism in this country just because he was black. He took it on because of his immorality. His immorality. Dr. King said the time is always right to do what's right. Always time to do what's right. Now, I know have you started school now? So I know you've been busy and you haven't had time to watch TV. Unless it's, wives of basketball and all that kind of stuff. Bad Girls Club. You know, you have to break up all that study just to have a little relaxation, right? But just a few days ago, this nation commemorated the 50th anniversary of the March on Washington. King's famous speech rocked this nation in its challenges and desires. King's mission was to stir the conscience of America, to make all of us look inside of ourselves. And here we are today, where black and brown people suffer and die prematurely more than any other group in this nation. Here we are today, a nation that spends more money on health care than all the top 50 industrial nations, and yet for too long, over 40 million citizens go without health care. For over a century, this nation collected health data on minorities and knew that there was a great health gap between the majority population and the minority populations, and yet little was done. While speaking at a medical convention in 1966, King put it best when he said, and I quote, "Of all the forms of inequality, injustice in health is the most shocking and most inhumane." Boy, was that a good one. You see, because then it wasn't until 1985 that Secretary Heckler of the Department of Health and Human Services decided that we needed to do something about it. We've collected this data for so long. We knew that black and brown people in this nation were suffering disproportionate to the majority. And so she put some things together. And from my point of view, King really put health care at the top of his priority list in the civil rights movement. For the last 25 years, health disparities is slowly finding its way on the agenda of many organizations such as the federal government, state governments, healthcare institutions, research venues, and foundations. I'm a lawyer by training. 10 years ago, I got involved because of things that I learned about what was happening to black people when I read about health disparities. And I consider myself a fairly learned person. And I was just horrified to see the statistics, the information. It shocked me. And you know what else? You see how fabulous this school is. Across the street, Children's Hospital has $2 billion, $2 billion in cash reserves. Yet we have one of the highest infant mortality rate in the nation here in Cincinnati. Many leaders have framed the issue of health disparities as one of social justice. Let me provide you with some data before you go to sleep on me. From a book that former Surgeon General Dr. David Satcher wrote, and I want to share this with you in order to give you a picture of what health disparities look like in America. Because when I got started, there was a young lady who was an associate dean, black woman, who had never heard of health disparities. Shocked me. But in Dr. Satcher's article, it was entitled Unequal Burden of Death. African Americans with age-adjusted death rates exceeded that of whites when it came to strokes by 50%. When it came to heart disease by 30%. When it came to cancer by 20%. And when it came to diabetes by 50%. You ought to come and go with me to the dialysis centers in this nation. And you will see that 8 out of the 10 patients are black people. Come and go with me to the nursing homes where you'll see young people. You'll see the majority are patients who are suffering from strokes, heart disease, HIV, AIDS, and complications of diabetes. Black people make up 13% of America's population, and yet more than 50% of the AIDS cases are in our community. Help me with that. I will never forget, back in the 80s, in San Francisco, white gays, it came and it started taking lives every evening. It was on the evening news. It was a crisis for America. White males dying in record numbers. And so the federal government got involved, the CDC and the states, and money poured in education, and they got in. And you don't hear about them suffering like that anymore. But yet, 50% of the AIDS cases are in our community, and you don't hear nothing about it. African Americans bear the burden of sickness and premature deaths. These are preventable deaths. Robert Wood Johnson just released a report of August 15, 2013, that the health gaps continue to persist and even increasing among certain groups. My brothers and sisters, health disparities are America's shame. It's America's shame. How can a nation that spends more money on health and health care than the top 50 industrial nations but have this profound disparity in diseases between the majority population and people of color? How can that be? In 2002, the Institute of Medicine issued a report entitled Racial and Ethnic Disparities in Healthcare. And here's what it said. 1, race and ethnicity are significant predictors of health care quality. That the vast majority of the studies indicated that minorities are less likely than whites to receive needed services, including clinically necessary procedures. And lastly, disparities in health will not be eliminated until conditions in communities are significantly improved. End of quote. Well, the healthcare system is no more colorblind than the legal system. Ask the parents of Trayvon Martin. Dr. Maury, president and CEO of the Robert Wood Johnson Foundation, who also happens to be an African-American female doctor, And she stated, and I'm quoting, "But in the United States, where disparities in health care are enormous, the problems has been largely anonymous. America's public debate on health has mostly centered on access to and affordability of health care. Even though a large body of evidence tells us that whether or not a person gets sick in the first place, in most cases, has little to do with seeing a doctor." It's the fight all about in health care. What's it about? It's about making people well, or is it about money? What has begun to emerge, my brothers and sisters, that not only do we get less than adequate health care, but that our health is disadvantaged because of where we live, work, and play. The large body of evidence that Dr. Morey was referring to are the social determinants of health. Today's civil rights movement continues to be about social justice for many of us. It is a fact that infant mortality rate of people of color is 2 to 3 times that of the majority population. I read some information from the health department. Almost 100 years ago, the infant mortality rate in Cincinnati and Hamilton County was just that. For blacks, it was 3 times that of whites. Fast forward 100 years, ask me what the rate is. It's the same. It is the same, in spite of this hospital over here that touts how excellent they are, and they get all this federal dollars. They are right here in the poorest black neighborhood in this city. What have they done? What are they willing to do? We can talk about that off camera. Let me give you some more information. The unemployment rate in blacks in 2010 was 16.8% as compared to 10% of the majority population. Now listen carefully now. I'm taking you somewhere. The annual median income for African Americans household is $21,000 less than that of the majority. In housing, 21% more blacks live in rental property than the general population. Blacks have 21% fewer marriages in comparison to the majority population. There are twice as many single-parent families household than the general population. When it comes to transportation, 20% of African Americans don't own cars. When we came out and started talking about food deserts, you know what food deserts are? Do you know what food deserts are? Some of y'all look like you're not sure. So if you don't have a grocery store in your neighborhood, how do you get fresh vegetables and fruits? Which is very important to be healthy. If you don't have a car, if you don't have adequate transportation, how do you do this? And we have a company here called Kroger's, headquartered here. Headquartered. It's about to become the biggest food chain in America. And they're shutting the grocery stores in the black neighborhoods like crazy. And here's their story. Their story is that they ain't making money. Now, how could they not be making money? Now, first of all, we have the highest rate of obesity than anybody. They spending some money somewhere. Cut the nonsense. If you want to learn more about it, go to policylink.org. And there's a whole study of what they call racial retailing, redlining. You know how they did in housing. Now they're doing it in the grocery store. You call preferred customers, shutting it down. Listen to this. Black males make up the largest population of the 2 million males incarcerated in this country. We make up the majority, and with 13%. In education, the dropout rate for black students was nearly twice that of whites. Blacks are twice times poorer than whites in this nation. The Pew Foundation reported in the fall of 2011 that the wealth of the average white family in America is $100,000. That's the wealth. What do you think it is for black people? It'll blow your mind. A little over $5,000. You don't have to be in prison to be on death row. We have become a nation of haves and have-nots. America isn't broke. It's the poor people in America who are broke. You've got 2% of the population controlling the majority of the wealth in this country. We can bail out Wall Street, but we can't fix the neighborhood streets. We can bail out the banks, but the banks can't bail us out. We ought to be outraged. You ought to be outraged that in this country, a land of so much, that we have so many people living on the streets of America. You have families who are living in automobiles as their homes. People sick and suffering because you have politicians, business leaders, and bigots still fighting the Affordable Care Act. You ought to be outraged. I don't understand why you're so quiet. You should be jumping up saying, right on, brother, right on. Okay. But as I close, I watched the other day some of the interviews of the great political, educational, business, civil rights leaders who talked about how far we come. Andy Young, Julian Bond. You know, that's something they always want to do, is talk about how far we come. Well, let's see how far we come. Yes, we have a black president and unprecedented numbers of black politicians holding various offices throughout this land. We have some black presidents of some of the most powerful and influential corporations in America. We have some black colleges and universities who are presidents of prestigious schools. We have black people who have reached unthinkable heights, whether they're sports figures or TV moguls like Oprah and Tyler Perry. And yes, we have some people who look like me, who have been admitted to several professional, social, and civic clubs that historically have been reserved for whites only. Yes, a number of us have individually prospered in this nation for the last 50 years, but have we really come so far? There's an old saying, and I'm sure you, being as young as you are, you probably haven't heard it. The more things change, the more they stay the same. Oh, we got some old souls out there. Well, let me tell you, I led students in the 60s on this college campus. I was 20 years old. We went to the president and we had 30 demands. He knew we meant business, and he conceded to those demands. People are benefiting to this day off of those demands. But the only problem is they're taking, but they're not giving back. They're taking and not giving back. But let me tell you this. I'm not ready to fill my champagne glass up with Dom Perignon and toast to how far we've come. My brothers and sisters, don't you be lulled into thinking that you've reached the promised land. But if you reflect on the data I've shared with you, you must come to the inescapable truth that we're still on the bottom of America. Because I say we are not free until all of us are free. Thank you.